Hi there. My name is Becca Dodmead, and today we're going to have a brief education session on PTSD in nurses and the implications of second victim syndrome. This is part of my SNHU academic preceptorship capstone project. I'm going to share my screen. So the learning objective for this brief education session is to apply knowledge regarding second victim syndrome to patient care scenarios. We obviously don't have enough time to go through many patient care scenarios, but we will briefly touch on one. And my hope is that you can use this to apply to not just patient care scenarios, but also in supporting your peers and your colleagues. So first, a review of PTSD. One of the common misconceptions, I would say, is that PTSD is related to something that you firsthand experience, and that's actually not always the case. Sometimes it's a trauma that someone close to you endured or knowledge of that trauma. And specifically for today's education session, we're discussing what can happen when a nurse has a medication error and whether there's an adverse outcome or sentinel event or the patient doesn't change at all. Sometimes the nurse can actually become a second victim of that because of the feelings of guilt and the weight of that. So two things that you can see with an individual trying to cope with PTSD is approach coping or avoidance coping, and they essentially are how they sound. Approach coping is proactively addressing the feelings, the intrusive thoughts, the negative emotions that one might feel when navigating this path, versus avoidance coping, which may present itself as self-medicating with substances or perhaps denial altogether. And so sometimes when people aren't sure how to cope with something, they attempt to shut it out. But as many of us know, it still festers under the surface. And so that nurse or that healthcare worker can become very unhealthy trying to navigate that path without actually facing the trauma and the fallout of that. So second victim syndrome was actually first coined by Dr. Albert Wu, and it's essentially describing the effect on a healthcare worker after they've made an error and that burden, that weight that they place on themselves, that feeling of responsibility for the error that was made. In some cases, ruminating and obsessing and wishing things were different. So it's not very surprising that for a healthcare provider, it can take many years actually to recover from the medical mistake they made. And so actually, really, if someone is using avoidance coping, it could take even longer. And if they're trying to face it head on, they still might not be able to make it through. And so specifically, we're going to talk about someone named Kim Hyatt, who you may or may not have heard of. Many people have heard of Redonda Vaught and the recent trial and all of the fallout at Vanderbilt after she made a medical error. But Kim Hyatt actually was a NICU nurse about 20 years ago. She was very celebrated, great NICU nurse by all accounts. She gave 10 times the dose of calcium chloride, and so it was determined that that contributed to the death of the baby, but not necessarily the root cause of it. But I'm sure, as most of us will, be able to relate to, the weight of that error weighed so heavily on her Kim really struggled to recover. And so after being let go from the Seattle hospital she worked for, she attempted to secure employment at a variety of places. Every time she would get a no, she'd pick herself back up and try again, and ultimately not being able to find more employment and losing this profession that she felt incredibly passionate about led to her succumbing to her mental illness, and she passed away about 7 months after the initial medication error. So ultimately, she was a second victim to that medication error. And the other thing that we have to consider is it's not just the nurse's actions when they give a medication. It's not just that we check all the rights of medication. It's also that there's an entire system working together. And so when there's a medication error, if it's not looked at objectively, then the errors are destined to continue to repeat themselves. And so not only did our profession lose Kim Hyatt, but ultimately we lost the opportunity to try to take that to improve care. And so sometimes nurses feel hesitant to report that they made a medication error. And so that's even more the case now after RaDonda Vaught in that trial. So in one of the more recent studies, between 210 and 440,000 deaths per year due to medical error. And something that really sticks out to me is that's only what we know. If we think about how afraid nurses and other healthcare workers are to report that they've made an error, it's very alarming that this number is so high. And so we really have to be proactive and approach this from a very open standpoint so that we can support one another, because otherwise we're just going to continue to be afraid and make more errors, and the cycle can continue and really have devastating results for us as well as the patients we care for. So one question, can we prevent second victim syndrome? What do you think? I think that trying to prevent it is maybe not realistic right now. If we advocate for, speaking up and debriefing and the things that we know can help the broader environment and the nurses that work around us, then we can start to chip away at this. But it's really going to take us working together and being very focused on just culture and ensuring that we're a safe place if someone's made an error and they're afraid, and no judgment zone, and make sure that we can help not only that nurse care for the patient and whatever fallout of the medication or other error, but also help that nurse care for themselves, because otherwise we're at risk to become another Kim Hyatt, and we don't want any of that. So in closing, I'll just say that I'm always a safe space. If you have anything that you need to talk about, if you're feeling unsure or like you don't have the resources you need to take care of yourself, you can always reach out to me.